Okay, good afternoon. I'll call to order this meeting of the Health, Environment, and Community Engagement Committee. I'm Councilmember Cam Gordon. I'm chair of the committee, and I'm joined by the full committee today: Andrew Johnson, Alon Dracano, Jacob Fry, Elizabeth Glidden, and Lisa Bender. Welcome, everybody. We have 9 items on our agenda. 1 is a public hearing, 7 are on the consent agenda, and 1 is a discussion item. I think what I'll do is go through the consent agenda first, in case anyone's here for that. They don't have to stay for the rest of it, and then we'll go to our public hearing on the first item, which is our emergency shelter ordinance. If any committee members want to pull off a consent item for discussion or any amendments or anything like that, we can certainly do that. The first consent item is number 2 on the agenda, and it's authorizing a 5-year academic institutional program affiliation agreement with the University of Minnesota School of Nursing to provide clinical experience for nursing residents. The third item on the agenda is a similar item, which is authorizing a 5-year academic memorandum of agreement with Winona State University College of Nursing and Health Sciences to provide educational experiences for their students. Fourth item is authorizing an amendment to a contract with Wetland Habitat Restoration for Restorations Ecological for Greenway Project. The fifth item is accepting a grant from Blue Cross Blue Shield for the Greenway Project. This is in the amount of $225,000 to support ongoing planning and community engagement for the North Minneapolis Greenway and the formalization of a North Minneapolis Greenway Council. Sixth item is accepting a grant from the Energy Foundation for $30,000 for energy benchmarking services for over 9 months. The seventh item is authorizing the submittal of a grant application to the Federal Centers for Disease Control and Prevention for up to $412,500 annually over 5 years for implementing prevention strategies for intimate partner violence among adolescents. And the eighth item, which is our last consent item, is authorizing the submittal of a grant application to the Federal Department of Justice for up to $500,000 over 2 years for continuation and enhancement of existing community engagement strategies focused on youth violence prevention. If anyone wants to pull anything off, they can do so now. Councilmember Fry.
Thank you, Mr. Chair. I'm reading this through as we speak, but this the agreement with Winona State University. Can someone provide a little bit more detail on it? This is item number 3.
Certainly, and I think Becky can come up and give us a little bit. That's a memorandum of agreement so that their students can get some field experience with our health department. But go ahead.
Oh,
Mr. Chair, Councilmember Fry, this particular one with Winona State is the first one for us, and how it came about was we ended up hiring 2 of their students for our seasonal inspectors in environmental health, and we have to have a written agreement for them to get academic credit.
oh, okay.
We do have probably a half a dozen other agreements for like the University of Minnesota, St. Thomas, St.
Right.
Mary's, wherever we need to. If we're using students or interns, we have to have an agreement in place so that we all understand responsibilities and liabilities.
Okay, so it has to do with our hiring and or internship practices as opposed to assisting theirs.
Mr. Chair, Councilmember Fry, it's for this particular situation, yes,
Okay.
it is, but it would allow us then over the 5 years if they have other students. And what we often find is if they have students who really like the work that they're doing with us, they're going to recommend it to others. And so I would anticipate perhaps getting more Winona students over the next 5 years.
And I'm assuming it's the same idea with the University of Minnesota School of Nursing as well, where we are engaging these students in some real experiential practices.
Yes, Mr. Chair, Councilmember Fry, the students we most are using from the School of Nursing are the graduate students, and they work in our school-based clinics. These are clinical experiences for nurse practitioners, not so much undergraduate. But
Okay. Thank you. I appreciate it.
Okay, thank you very much. Seeing no other questions or comments, then I will move the consent agenda. All those in favor, please say aye.
Aye.
Any opposed, say no. Those items then are approved. And now we'll go to our first item, which is a public hearing on an ordinance amendment, the Emergency Shelter Ordinance Amendment. And before we open the public hearing, we'll get a brief presentation. And welcome.
Good afternoon, Chair Gordon, council members. I'm Ryan Crick, Supervisor of the Health Department and Food, Lodging, and Pools Program. Just before I start, I'd like to thank Shanna Sather and Dan Callahan, Pat Higgins from Construction Code Services and CPED for helping us with this. This is for the addition of emergency shelters and adding a chapter 236 to our health and sanitation. At the end of 2015, zoning did a text amendment to allow a new category of shelters, emergency shelters. What this does is allow some smaller shelters to operate outside of the downtown area and not require them to have accessory use to a place of a religious institution. There's a couple nonprofit homeless advocacy groups that expressed interest in possibly doing this in other areas of the city. We put together some rules to operate under this license. Some minimum rules just maintain a safe and maintainable facility. We wanted to make sure that it had proper laundry services, bathrooms, and it was constructed properly. All these facilities will need to comply with the Minnesota Building Code, Fire Code, and any accessibility requirements for those facilities. That concludes my presentation for today. We'll be happy to answer any questions.
I guess I have a question in terms of the emergency shelter that will have 10 or fewer occupants. What kind of requirements does the building code put on that building in terms of what kind of infrastructure it's supposed to have? Does this require a full sprinkler system or those kinds of
I'll refer
ideas?
to Dan.
Thank you very much.
Mr. Chair, council members, I'm Dan Callahan, Construction Code Services. Building code generally deals with shelters very similar to motels. As far as accessibility provisions, the code would require an accessible route to an entrance, at least one accessible sleeping room, and that individual on that accessible floor would need access to a restroom, which would include either a shower or a bath. And if laundry facilities are provided, accessibility would be required to the laundry facilities. And being that the ordinance appears to require laundry facilities, that would require accessibility then. And then whether the facility was 10 or fewer or greater than 10, the sprinkler rules generally would kick in if the facility was 4,500 square feet or larger. There may be some exceptions if somebody used an existing motel, since that would not be a change in occupancy. If there was really minimal construction work going on, there are some exemptions for sprinkler, provided it's not a major remodel.
When you say an accessible bathroom, does that mean the door has to be wide enough for a wheelchair to get in and out, and there has to be grab bars and those kinds of things?
Correct.
Okay. All right. And that would just be if there was, so there'd have to be one bedroom on the first floor, and there'd have to be a bathroom that that person could get into.
That's right.
All right. Thank you very much.
Thank you.
Does anybody else have any questions or comments about this? Okay, then. I think that's good for the presentation. And now we'll open the public hearing. I don't believe anybody has signed up for the public hearing, but this is your opportunity to get up and speak now if you're here to speak on this. Seeing no one, then I'm going to close the public hearing. And then I will move this ordinance forward. See if there's any discussion or questions. Councilmember Frye.
Thank you, Mr. Chair. Are the shelters generally on board with the change?
Yes.
Okay.
This, we went through a lengthy community engagement process, and we had a steering committee and a group that helped us earlier when we were drafting the zoning code amendments. And everybody was, I think, open and understanding that for these emergency shelters where people could stay up to 30 days, that there would have to be some licensing and code work done. And I believe this fits the model. And I know that if anybody, you can correct me if you think that it doesn't, then other people in this room were involved in that. Okay. Any other questions? Okay, then I think we're ready to vote. All those in favor, please say aye.
Aye.
Any opposed, say no. That motion carries as well. Thank you very much for being here. Appreciate it. And hopefully, we'll see some more shelters opening in different parts of our city soon. But I guess we'll have to see. Time will tell. That brings us to our final item, which is the blueprint for equitable engagement. This is something that came up back in April, where we had a presentation about this, and we decided that we would table it and hold it over for a little bit so that we would give ourselves a chance to be all briefed by staff on it and see if there were any suggestions or amendments. The plan now is to adopt this, and there's actually, I'll just let my colleagues know, there's one amendment and a staff direction that I'll be moving to go along with this based on those discussions. Mr. Rubador, did you want to say anything about between then and now?
Chair Gordon and committee members, I've had a chance to review the staff direction. I think that is actually a good staff direction. I like the notion of being able to report back annually. It'll keep the work alive and also provide some accountability to the public about the work that's being done here. So I'm in support of the amendment and also the staff directive.
All right, appreciate that. I'm not seeing any other questions or comments, so maybe what I'll do is I'll move to amend, I guess, the plan first before I move for approval of the plan. And this is it's a rather minor amendment that you have in front of you. There are a number of different strategies in the plan, and under each strategy there are activities. And this came up with discussions with policy aides, the idea of maybe we could strengthen the first activity under strategy 2 to add the words "and discouraging and preventing exclusion" at the end. And I'll read the whole activity and where that fits in the end for everybody so they can see it and hear it in the sentence. This is work in collaboration with neighborhood organizations to encourage meaningful involvement of more residents in neighborhood organizations. Focus on engagement strategies on identifying and removing barriers to full civic participation and meaningful engagement, and discouraging and preventing exclusion. So just, I think, supporting but putting an emphasis in that. Any questions about the amendment? Comment? Seeing none, all those in favor, please say aye.
Aye. Aye.
No. Any opposed? All right, that carries. Then I'm going to move that we adopt the blueprint for equitable engagement as amended. Any discussion on that? This is a 5-year plan, and I really appreciate the work that staff has done in this and the commission, and actually I attended some of the community meetings, and neighborhood organizations certainly weighed in and were involved too. So all those in favor of adopting the plan, please say aye.
Aye.
Any opposed? No? All right, that motion carries. And then finally, there's a staff direction, and this is kind of grew out of the discussions and the briefings that staff had between the April presentation and today. It reads as follows. Direct the Neighborhood and Community Relations Department to report to the Health, Environment, and Community Engagement Committee annually on progress made in achieving the goals of the Blueprint for Equitable Engagement. Furthermore, direct the NCR Department to continue working with the City Coordinator's Office of Equity and Inclusion, the City Clerk's Office, and the Civil Rights Department to develop goals, metrics, strategies, and tools for city staff, neighborhood organizations, and boards and commissions to assist them in assessing and improving inclusion and equitable community engagement efforts. Any discussion on that staff direction? Seeing none with this, our remarkably efficient committee, I will then move the staff direction. All those in favor, please say aye.
Aye.
Any opposed? That motion carries. And I think that concludes our business for today. Thank you very much, everybody, for your participation and attention. This meeting is adjourned.
Nice work.